Good afternoon and welcome to Afya Focus here on Citizen TV. I'm your host, Sally Malinda. Afya Focus is going to be a premier health program that will be packaging for you holistic health and medical issues concerning you, our communities, and ourselves as a nation. This program will be coming to you every Sunday afternoon at 3 p.m. here on Citizen TV, and being a live program means only one thing. You will be having a chance to interact with us live on studio by way of calling, SMSing, or you can send to us email. We will be having a qualified or different panelists who will be addressing these issues every Sunday afternoon. Well, going back to independence, one of the key issues that the government sought to address is eradicating disease. 47 years down the line, how have we performed as a nation? Are Kenyans able to access quality and affordable healthcare? We will be getting answers on these questions from the Permanent Secretary, Ministry of Medical Services, Professor James Olekiapi. But first, let's set the stage. Kenya's economic framework, Vision 2030, stipulates the following vision of the health sector: a nation free from preventable diseases and ill health, an efficient, integrated, high-quality and affordable healthcare system. In line with Vision 2030, Kenya will restructure the health delivery system and also shift the emphasis to promotive care in order to lower the nation's disease burden. According to the National Health Sector Strategic Plan, the Health Ministry's strategic plans, and Vision 2030, the key objectives can be summarized as follows: increase equitable access to health services, improve quality and responsiveness of services, improve efficiency and effectiveness of service delivery, enhance the regulatory capacity, foster partnerships in delivery of services, and improve the financing of the sector. In line with this, and on Afya Focus Live, we seek to find out how far have we progressed. We will look into conditions, governance and policy issues that have an impact in our health sector and how we, as a nation, can effectively manage our own health challenges. Welcome back. Well, now, welcome my guest, the PS for Medical Services, Professor James Olekiapi. Welcome to Afya Focus.
Thank you, Sally.
Now, how is the infrastructure or capacity for our healthcare system in Kenya? Are Kenyans able to afford or access quality healthcare?
Basically, in Kenya, our health infrastructure has expanded a great deal. In fact, our biggest challenge is that because of also the increase or the growth in population, the population growth has not been matched by the expansion in health infrastructure. So although we have hospitals all over the country, we have health centers, we have dispensaries, we have sub-district hospitals, because we have about 274 hospitals. They face a number of challenges, but I can say that there are pluses, that there are wins, but there are also areas where we need to really move very fast if we are to leverage the huge human population that we now have in the country.
On and off, we've been having concerns that the budgetary allocations that the Ministry of Health is supposed to be receiving from Treasury is 15%, but apparently your ministry receives only 7%. How do you explain that disparity?
This 15% was a commitment by African governments in Abuja. They said that, at the very minimum, governments should commit at least 15% of the annual budget for health. In our own case, we are doing 7%. That's where we are challenging Treasury. We are saying that we must be making progress, move from 7, maybe up to 10, up to 12. It's still very low because we are about halfway. But of course, you have to look at it vis-a-vis other social and economic needs.
Going back to policy issues, we have the Universal Health Scheme that is being advanced at various levels. Do you think this is going to be the solution to Kenyans' health problems? And how viable is the scheme?
Even before you talk about the scheme, there are really two important things that we need to understand. Number one, healthcare, if you're going to really make sure you have given people good healthcare, there are three characteristics. Number one, it must be accessible. That means anybody and everybody in the country should be able to access some facility. Two, it must be affordable. Three, it must be quality service. Now, for that to happen, then you must address the issue of funding and also the issue of the system itself, the infrastructure. Then once we do that, we then address the question of can people afford? And right now what the ministry and the government has been doing is coming up with what we call social health coverage or social health protection, which is to say we want to guarantee at the very minimum that every Kenyan citizen has access to basic health services, even if they can't afford. So we are doing both, improve the system and develop the coverage. And thirdly, NHIF must work. The NHIF is currently just covering hospitalized patients. You have to go to hospital and you claim. But what we are saying now in this new arrangement is that NHIF can give a broader range of services, health services, to cover both outpatient and inpatient.
Lastly, we have the issue of availability of drugs. Is it because there is a lack of money, or is it procurement? Where are the missing links? On and off we hear
No,
this shortage of
we
drugs.
had a shortage and it was quite simple. Really, there was no complication about what was the reason. The reason was that we didn't have a budget, an adequate budget, because we requested, for example, initially in our budget for last year, for this financial year, 2009, 2008, we requested 1.8 billion to buy drugs, essential drugs. We call them essential drugs. And we requested 500 million to buy ARVs from government. And at that time, Treasury was only able to allocate us about 900 million, which was half of what we requested, and actually nothing for ARVs.
And just one more critical question is that your ministry has been, I don't want to use the word accused, but we're more of curative than a preventive society and promotive in terms of the way we execute our medical policy.
I think one of the best outcome of and that is contrary to other people's belief, but one of the best outcome of the Grand Coalition government was the splitting of the ministry a little bit, because now the Ministry of Public Health and Sanitation is actually focusing more on what we call primary health care, prevention. Now, there are two issues here. Number one, the whole portfolio of prevention is not merely just going to talk and say prevent. It depends on what we call the social determinants of health. One of them is environment. If you're degrading environment and there's drought and there are floods, it doesn't matter how much noise you make, people will still be infected. Number two, even in a very clean environment, people still get sick. Because if environment, of course, or if just taking care of prevention were the case, then people in developed countries that have figured out these things would not be having this. So I think we must balance. We must have both. We must make sure that the entire system, from the primary healthcare, from the community level, we must go to the community, but also we must make sure what is community level interventions are linked up to tertiary level interventions, which means treatment and prevention as well.
Okay. We'll be watching keenly to see how well your ministry performs, but we are hopeful that Kenyans are going to progressively to be getting accessible and quality healthcare.
I don't want to give the impression here that the health system in Kenya today is adequate and no problem. No, I really don't want to paint that picture. I want to simply say that we are making progress. We have made progress. We're making more progress, but there are still challenges. But we are working very hard to address them.
Clearly, the challenges are there, but as you say, we have made a lot of progress as a country.
Absolutely.
Well, at that point, thank you so much for joining us on the first debut program on Afya Focus here on Citizen TV. It's been a pleasure to have you as as our guest, and we look forward to talking more about what is happening in the health sector in Kenya.
You're most welcome.
Well, that was the Permanent Secretary, Ministry of Medical Services, Professor James Ole Kiapi, giving us highlights on the status of the healthcare infrastructure in Kenya. We are taking a short break. When we come back, we'll be looking at HIV and AIDS interventions. We'll be talking to two officials from NASCOP after this short break. Well, you're watching Afya Focus. Thank you for staying with us. And now introducing my next set of guests, Dr. Ochieng and Mr. Dwiga from NASCOP. Welcome to Afya Focus.
Thank you.
Now, there is the critical issue of whether circumcision is an intervention to HIV and AIDS. Probably we can start with you, Dr. Ochieng. Is it or is it not?
Well, first of all, coming up with the background, the circumcision communities were known for a long time to have lower rates of HIV than the non-circumcision communities. Previously, it was thought to be cultural or religious-related reasons. But by and by, since 2005, they started to put some sense into it and started doing studies, which they did also histological studies whereby they look at the tissues under the microscope. They discovered there's some cells also that attach, the HIV cells attached to, and which make the person who's not circumcised more prone to getting infected. So yes, it is a preventive measure towards HIV/AIDS.
Dr. Dwiga, have you done any interventions or any campaigns on circumcision as a preventive mechanism to HIV?
Yeah, based on what Dr. Cheng has said, we have started campaigns on male circumcision as one of the interventions at NASCOP. Mainly a program started in the year 2007, and based on the KAI's report, whereby Nyanza was one of non-circumcising community with low levels of circumcision, and also one of regions with the highest prevalence rate. We started campaigns on male circumcision, and one of the areas that we have been able to focus was Nyanza, based on that KAI's report. And we have been able to do most of the campaigns in Nyanza, and we are in the plan of scaling up to other regions in the country.
Is there any way we can, or are there plans that you've put in place to tackle the issue of traditional, circumcision? Because we know that for sure it's a way that people share knives, and that spreads the HIV and AIDS virus.
One of the tools that you have in our program is a strategic plan, which goes up to 2025, which we plan to have phases. We split it into 3 phases. The first phase actually was to where the load was heaviest in the circumcising communities, which that's where we started the Luos, then moving on to the Tesos and Turkana. After this phase, which is going to take about 3 to 5 years, which not mutually exclusive, you're going to move on to the second phase, which you're going to tackle how the traditional circumcising communities, of which you're already currently moving into it. And yes, we are seeing, we're doing operational plans to see, operational research to see how we're going to tackle the circumcising communities.
And just to finalize, Dr. Dwiga, what lessons have we learned so far on the prevention of HIV and AIDS?
Yeah, we have learned a lot, especially on the medical male circumcision, that there is need to have good political support in terms of implementing a new program in Kenya. Secondly, issues of having good partnership, especially with partners, mainly who are funding most of these programs. And then more to that, we have learned good lessons in terms of community engagement and involvement in implementation of program, especially those who have got some social perspective in terms of understanding and acceptance of programs. Yeah, mainly we have learned those things as one of the key.
And do we say we are winning the war on the fight against HIV and AIDS, Dr. Ochieng?
Yes, I would say we're doing pretty good. Right now, Kenya in Africa is actually a role model to the other countries. The program in Kenya is doing pretty well. Like male circumcision, what we've done south of the Sahara is about 3 times all the other countries combined towards the prevention of HIV/AIDS. I can say this, that you're doing very well, pretty well.
Well, thank you so much, Dr. Dwiga and Dr. Ochieng, for joining us on Afya Focus. We're grateful for your insights, and we look forward to having you again on set as time is not on our side now. but we look forward to having you again so that we can discuss more on the fight, or where we are as a country on the fight against HIV and AIDS. Well, that has been Afya Focus here on Citizen TV. I've been your host, Sally Malinda. Thank you for watching, and we meet again next Sunday, same time. God bless.